In this video, I'll reveal it all, exactly how much GPs earn in the NHS, and I have a feeling you're going to be in for a surprise. This can get a bit complicated, but I'll try and keep it as simple as I can. There are broadly three ways of working as a GP. You can either be a GP partner, or a salaried GP, or a locum GP. Practices are set up as their own individual companies that have an agreement with the NHS to see patients in their local area and provide some essential services, things like smear tests and childhood immunisations, for example. On average, each GP practice has about 10,000 patients registered. And how much is the entire GP practice paid per patient? Well, you can watch this video for more details, but as of data about 2 years ago, GPs were paid on average about £163 per registered patient. And that's for unlimited appointments at their practice. So whether you saw your GP once per year or 12 times per year, they still just get the same £163 for the whole year for that patient, which is probably cheaper than what you pay for Netflix. Now, a GP partner is essentially the owner of that GP practice. So it's the company that has the agreement with the NHS, and they'll hire lots of staff to keep the practice running. So the reception staff, secretaries, nurses, healthcare assistants, and other employed doctors. Once all of their salaries are taken away, the cost of the rent for the building they're in, and the cost of running that building, then they get whatever is remaining. And this figure varies quite a bit, so it's hard to give a clear example, but on average, they make about £138,000 per year if they work full time. Which might sound like a lot of money, and it is, but given that they're responsible for running the practice and dealing with all of the complicated and tricky aspects like all of the compliance and complaints and so on, it's not just a full-time job. They end up spending way more than just 40 hours per week looking after the practice. But even if you calculate their working hours to 40 hours per week, which is definitely conservative, that average salary means they earn about £69 per hour. And I'm sure you'll have your own opinion on whether that's fair or if that's too high or too little, but personally for that level of stress and the challenge of their work, I think they are vastly underpaid. Now let's compare that to how much an employed GP, also known as a salaried GP, earns. So this is someone who works for the practice and gets a regular paycheck but is not responsible for the running of the practice. So in terms of seeing patients, their responsibilities are the same, but they'll have less of the non-clinical things to deal with. Their pay is calculated according to the number of sessions that they work, and a session is defined as 4 hours and 10 minutes. And within that session, no more than 3 hours should be spent in consultation with patients. So essentially, a session is a half day's work. So if you worked a full day, you'd be paid for 2 sessions, as that's 8 hours and 20 minutes work, which is a normal working day. So how much does a salaried GP earn? Well, the average going rate is about £10,000 per session. Now, this doesn't mean that they get £10,000 for every half day of work, that would be crazy, but it means that if they work that session every week for a year, they would get £10,000. So if I worked 1 full day a week, every Monday for example, for a year, I would be paid for 2 sessions, so that would be £20,000 for the year. So if a salaried GP worked 3 days per week, they would earn £60,000 in a year. And if they worked 4 days per week, they would earn £80,000 in a year. Now, if we were to calculate how much they earn per hour, if you base this on them working purely within those 4 hours and 10 minutes of a session, it would work out to £46 per hour. But in reality, they're definitely going to be working some overtime, and sadly this won't be paid extra. So it really works out even less than this. Finally, let's look at how much a locum GP earns. A locum is a bit like a freelancer or a contract worker. So they are self-employed and they offer work by booking a shift at different practices here and there. Or sometimes it can be at a single practice for a fixed period of time, like 3 or 6 months for example, like when you cover someone on maternity leave. Now their pay is a bit more straightforward. Generally they'd be offered between about £80 an hour up to £100 an hour. Sometimes this is calculated per session, so it might be £320 per session, for example. The exact rate depends on a lot of variables, like how desperate a practice is to fill a gap in their rota if one of their employed GPs is off sick at short notice. But if a locum GP was to work 4 days per week with £80 per hour, they would make almost £120,000 per year, assuming they were to take 6 weeks of annual leave. Bear in mind that there may be some variability with all of those numbers, but those are the typical figures that you would see in those different ways of working as a GP. Now, while that might sound like a lot of money, bear in mind that GPs have a lot of professional fees that they have to pay for, which makes a big dent on their earnings. So things like, for example, indemnity, which is the insurance they need to pay to see patients, or fees to the Royal College of GPs, or the General Medical Council, who are responsible for registering doctors. All of those things add up, but hopefully that's lifted the lid on how much GPs earn. If you found this video interesting, you might also be interested in this video on how much junior doctors are paid, or maybe this video about why GPs are so busy right now. And thanks for watching, I'll see you next time. See ya!